Thank you very much. Just give me 1 second here. All right, so as I pull up my slides so I can see them and not have to turn around, I want to say thank you so much for this invitation. June, we got in contact because one of the things that I do, although I should mention, you'll notice on my slides that I am the Associate Dean of undergraduate pharmacy programs now. I did 3 years as Vice Provost in University Administration, but finished that 3-year term. So now I'm back in the School of Pharmacy working with our pre-pharmacy program as the Associate Dean. So in that role, I reach out to the various advisors at the different schools to come out and talk to their students about pharmacy. And the vast majority of my presentation will be about pharmacy and what it means to be a pharmacist as opposed to our program specifically. So let me get into it because I only have 20 minutes and I have a lot to say. So first question in terms of the top 10 things or top 5 things you might not have known about pharmacy is, where do pharmacists work? What would you say? You can just kind of yell it out. Where do pharmacists work? In pharmacies, yes, but like more specific than that. Like what type of pharmacies? CVS. Walgreens, right. Okay, so retail pharmacy. Anywhere else? Costco, Target, Walmart, those are called mass merchandise pharmacies. All right, anywhere else? Hospitals, right? Anywhere else that you can think of? Yeah, that's most of what people know. So here's the deal. These are the places you probably know about: the chain, independent, grocery store, mass merchandise pharmacies, hospital pharmacies. There's also compounding pharmacies that specialize in just making compounded versions of medications that aren't available through the normal chain of distribution, right? So it might be a different strength for the medication or a different formulation that the pharmacist is making up. And then academia, obviously, you probably know that pharmacists work in academia. But you might not have known that there's pharmacists working in doctors' offices, in medical groups where you have groups of doctors that work together to care for patients, also in accountable care organizations, in health insurance companies, in the federal government, a number of agencies there, FDA, HRQ, CDC, and so forth. Nuclear pharmacies is a place that most people probably don't know about, and if you want to know what that is, you can ask questions about it during the Q&A. But home infusion pharmacies, veterinary compounding, so we have pharmacists that make compounds for horses and dogs and cats and birds and everything else, because there's a lot of medicines that aren't available for those animals. And then even state and national pharmacy associations. In fact, this is back from 1998, so there's more opportunities now. But there's a study that was done that showed there's about 180 different things you can do as a pharmacist, right? Now, the great thing about pharmacy is that you have the direct patient care type of environments that we talked about, but there's a lot of office-based pharmacy jobs where the pharmacist uses their knowledge, their expert knowledge of medications to help, like in a 9-to-5 type job for an organization, right? So the great thing about being in pharmacy, you can work in retail for a while and then maybe go over to compounding for a while and then go to like a office job in a health insurance company like Kaiser or Blue Cross Blue Shield, Humana, and so forth. But there's tons and tons of different jobs. Obviously, the pharmaceutical industry is another place that employs a lot of pharmacists. So a lot of opportunities. My laptop just died. Next slide. We're just going to roll with it. The second thing you might not have known about is some of the famous pharmacists out there. Next slide. So Alexander Fleming, if you've heard of penicillin, which is an antibiotic that we use for infections, right? He actually discovered penicillin quite by accident. story goes that he had like some mold from an infection in like a petri dish, right? And he happened to be eating lunch or something like that. Not eating lunch, but he had some moldy cheese that happened to be sitting next to the petri dish. And he found that the bacteria in the dish that was close to the moldy cheese like went away. And he couldn't figure that out until he realized that the mold actually was penicillin, you know, and so would actually get rid of infections, and that's how we got penicillin. Friedrich Sertner separated morphine from opium, and again, these are all pharmacists. Next one. John Pemberton, everybody's heard of Coca-Cola, right? You may not have known that Coca-Cola didn't start out as a refreshing beverage to go with your McDonald's Big Mac. It actually started as like a medicine for people with stomach ailments. And yes, it did include cocaine, the original formulation, and quite a good amount of alcohol. But of course, he realized that it was quite popular, but then realized you can't like have everybody drinking alcohol and cocaine. And so, so they got rid of those ingredients, and he created the formula for what we know of as Coca-Cola. Interestingly, Dr. Pepper wasn't created by a pharmacist. Hubert Humphrey, from history class, you know he's a vice president under Lyndon Johnson. He was a pharmacist. Next, Benedict Arnold. We all know Benedict Arnold, right? He actually was what they called an apothecary, which is an early term for pharmacists, right? He's not one of the pharmacists that we're proud of, so we don't mention him much, as you can imagine. Next. All right. And the interesting thing is, you know, most of people's mind when they think of pharmacists, they think of CVS, Walgreens, Rite Aid, Target, and so forth, right? Where the pharmacist fills the prescription, you know, gives a consultation to the patient if needed, right? But that's really the image. And for, you know, several decades, that was the majority of what went on in pharmacy, was the dispensing process of medications. Next slide. But we've had, since about 1996, less of an emphasis on the dispensing role of pharmacists and more on what we call team-based care. So the picture on your left has a physician, a pharmacist, like a dietitian, maybe a dietitian, and a nurse. Thank you very much. We can't forget our nurses. My wife's a nurse, so she'd kill me for forgetting about that. But not a pulmonologist, respiratory therapist, right? You know, so a lot of times patients have conditions that would benefit from expertise of a lot of different people besides a doctor. I know it shocks you. Doctors don't know everything, right? They know a lot, and we love them, and they're great for our healthcare. But having a team approach to care, and now we have pharmacists included in that, because pharmacists are the medication experts. For those of you who are planning on going to med school, you'll find out in med school you might get one semester of pharmacology, right? Pharmacists have 3 years of, you know, pharmacology and drugs and how they work and how to use them in the system. So the one on the right is what we call a clinical pharmacist. This is a pharmacist who's graduated and has gone on to get a 2-year residency after graduation, and we have residency specialties in so many different areas: pediatrics, oncology, which is cancer treatments, cardiology, endocrinology, critical care, emergency medicine, right? You know, pretty much every kind of specialty a physician has, we have a pharmacist with a residency specialty. And they actually round with the physicians and the residents in the hospital and make recommendations on what medication and what dose the patient should get, right? So again, you probably didn't know that. Am I correct? Yeah, all right, excellent. And then we have changes in pharmacy practice due to this California Senate Bill 493, which is really exciting for pharmacy. So this bill did 2 things. One, it expanded the types of things that a regular pharmacist with a regular pharmacy degree and pharmacy license can do, and that's what you see on the slide here. So now all pharmacists in California can administer drugs and biological products that have been ordered by a prescriber. They can provide consultation, training, and education about drug therapy, disease management, and disease prevention. They can participate in multidisciplinary review of patient progress, including appropriate access to medical records, perform other functions like self-administered hormonal contraceptives, nicotine replacement products, and prescription medications not requiring a diagnosis that are recommended for international travelers. That's like travel medicine. So if you go to Africa or some parts of Asia, you know, you have to get certain shots because there's communicable diseases over there, and especially malaria. And then they can order and interpret tests for purpose of monitoring and managing the efficacy and drug toxicity of drug therapies, and to independently initiate and administer routine vaccinations, right? So we know that during the COVID epidemic and pandemic, pharmacists were in the front lines of not only doing COVID tests in the pharmacy, but providing the COVID vaccines. But pharmacists have been giving vaccines and flu shots since 1996, right? But COVID really brought it to the forefront of everyone's mind. So again, these are all things that any pharmacist in California can do. Next slide. But then we have this new designation of a pharmacist. So when you graduate from pharmacy school, you have to take the NAPLEX exam, which is the National Pharmacy Licensure exam, and then you have to take a state law exam. And once you pass those, then you can get licensed by the state of California as a pharmacist. So we call it a registered pharmacist. Once you've done that, now this Senate bill allows pharmacists to go beyond that if they have done a residency or done a year working with a physician in a collaborative manner, and they have some type of certificate in medication therapy management, that they can then apply to the state board to become an advanced practice pharmacist. And now what that allows those pharmacists to do is to perform actual patient assessments. So that means the patient comes in, they're working in a clinic, obviously, right? And they can, you know, talk to the patient, find out what's going on, look at their lab values to see how well they're doing for their chronic diseases. And it's usually in the realm of chronic diseases, not acute conditions. But they can order and interpret drug therapy tests in coordination with their patient's provider. They can refer patients to other healthcare providers. But the big thing is they can prescribe medications, write prescriptions, right? Now, in the law, it doesn't say pharmacists can prescribe. And the reason is, in California, the physicians feel that prescribing is more than what pharmacists thought it was. So the actual law says that they can initiate, adjust, and discontinue therapy, right? Which means they can write a new prescription when a patient needs it. They can write another prescription if the patient needs to change from one medication to another. And then they can, you know, stop a patient from taking a medication based on the needs of the patients, which I'm guessing, how many people knew pharmacists could prescribe medications? Right? Maybe a couple of you guys, right? Because it was possible in the VA system. You guys know VA, the Veterans Administration, right? Because they're a government agency. Pharmacists have been able to do it in that environment for a while, but now in the general population, we can do it. So a really exciting time for pharmacists to be able to be more engaged in direct patient care. So it works out very well. Next slide. All right. And then what pharmacists are doing. So I'll ask you guys a question. I'm going to have on the next slide a list of things. And so what I want you to think about, and we'll spend a few minutes, you can talk with like your neighbor or a couple other people at your table and try and see if you can figure out which of these things do you think that there's like literally no pharmacists in the US that are trained and legally able to do. And so here you have it. So diagnose chronic disease, diagnose a cold, diagnose the flu, diagnose certain rashes, manage the therapy for someone with diabetes or high blood pressure, test someone's blood to see if their diabetes is under control, test their blood for cholesterol, take someone's blood pressure, give someone a flu shot, give someone a vaccination, order a lab test, and write a prescription. So take a moment or so to discuss at your table. Basically, you know, by number, which of these things you think there's like no pharmacists in the U.S. that are able to do this. All right, so I'll give you a second. All right, glad to see such excited discussion, although I'm sure some of the discussion was about famous K-pop bands and what's on Netflix. But so for the group, like what came up at your table as to ones that pharmacists, there's no pharmacists in the U.S. that are able to do? What would you say? And you can call it out by number, and then I can read it. What you guys come up with? Number 12, okay. Write a prescription for a medication, okay. So you said number 1 or none, so they can do all of them, okay.
5.
Number 5, manage the therapy for someone with diabetes or high blood pressure, okay. A couple more thoughts out there. Who said that? Okay, number 1. All right. And so, seeing no other ones, we'll go to the next slide because the answer is number 1. Like, that's literally the only one that there's no pharmacist out there that can do. Now, some of you guys are obviously confused because you say, if they can't do number 1, which was diagnose a chronic condition, how could they possibly diagnose a cold, the flu, and certain rashes, right? Like, diagnosis is in the realm of physicians, not pharmacists. But here's the thing, right? Cold, flu, and rashes can all be treated with over-the-counter products, right? So any condition that can be treated with over-the-counter product can be diagnosed by, and is diagnosed by, the pharmacist, and then a recommendation for treatment is given. And this includes like GI issues or migraines, right? You know, like I just put a couple up there, but there's tons of conditions that can be treated with over-the-counters that the pharmacist will have a conversation with the patient. They'll tell the pharmacist what symptoms they're having, and then the pharmacist will let the patient know what they should take. Because even for rashes, right, there's rashes that can be treated with steroids like hydrocortisone cream, and the pharmacist has to figure out like what type of rash it is, because if it's a yeast rash and needs to be treated with an antifungal like nystatin, you know, it's not going to benefit from hydrocortisone, right? So pharmacists are doing this diagnosis process. In terms of number 5, managing therapy, you know, for sure that's what the advanced practice pharmacists are doing, but pharmacists have been doing this in terms of doing disease state management since the early 90s, and then we called it pharmaceutical care, and then we called it medication therapy management. And then someone said another one, I can't remember, oh, number 12. Yeah, we won't discuss that one. Because, yeah, advanced practice pharmacists obviously are able to do that one, which is pretty exciting. All right, next slide. Oh, my God, I was awesome, right on time. 20 minutes in. So we'll now go to questions that you might have. Yes, sir. What percentage of pharmacists are minorities? So if you're asking about all minorities, right, it's probably about maybe 15 20%. Like in California, it's like maybe 70, 80%, right? I mean, look around the room, right? But if you take the entire nation, you know, it's probably about 15, 20%, because you have about, you know, 8%, 10% black, about the same, a little bit more Hispanic, and then Asian, right, is less of a percent nationwide, because they're less of a percent nationwide just generally. But yeah, and we're getting better, thanks to California. Yes, ma'am.
You kind of touched on it earlier, but what is nuclear pharmacy?
Ah, nuclear pharmacy. So, how many of you guys have ever seen a movie or TV show where the doctor has a patient in the room and they're giving them the bad news that they have cancer, and they put a slide up on the, you know, the white box, and they're pointing at these white big blobs that are showing up on the x-ray. Has anyone ever noticed that, right? Yeah. So cancer doesn't normally show up on imaging. It needs something to show up on imaging. So nuclear pharmacy, what they do on a daily basis is they take an IV solution and then they inject it with radioactive particles called isotopes, right? And so they put a certain amount of isotopes in this volume of IV fluid. The key is, as you can imagine, these are radioisotopes. So you have to be extremely careful when you're doing it. That's why it's a niche area for pharmacy, right? The techniques you use and the gown and clothing and everything else that you wear has to be specialized. The hood that you do it in has to be specialized, right? And so basically, once that IV is made, it goes to the floor and it's administered to the patient. It goes through the bloodstream. And as we know, tumors have like blood vessels going into them because that's how they survive. And that means those isotopes go into the tumor. So then when the patient is imaged, it shows up like bright white on the image, right? And so it's used for diagnosis processes, not that much for treatment, but that's what a nuclear pharmacist does. Yeah, they don't work with nuclear weapons or work in nuclear silos. Yes, sir.
Do you think pharmacists are in any way responsible for the opioid crisis that has been going on for a long time and is continuing to evolve? And if so, do you think there's anything they can do to help curb the crisis?
That's a very good question, right? And the answer is really complex, right? So if you ask me, are there some pharmacists out there, and I would really say pharmacy owners, because most pharmacists are workers, right? Like to them, they just feel what comes to them. Like they're not in it for profit or anything like that, right? But for some pharmacy owners, are there some that were like, oh, you know, I can make money working with a doc and they write a bunch of scripts, you know, and I can fill a bunch of scripts and make a lot of money? Sure. But that would be the minority of pharmacists out there. The interesting thing about the opioid crisis, right, is that, number one, pharmacists have to, for the most part, dispense whatever is written by the doctor, right? So honestly, if there weren't scripts written by the doctors, there wouldn't be an opioid epidemic because the patients can't get it any other way but by prescription. Now, I'm not just blaming the physicians because they have a hard time because they have long-term patients that come in and they demand it. They don't want to give it to them, but they don't want to lose the patient, right? So they're kind of stuck in a weird situation. But when it comes to the pharmacy, yeah, now if they notice that this patient came in like last week for some opioids and now they're coming in for another one, the system will flag it and they'll have a conversation with the patient, say, oh, you just got 3 weeks supply or a month's supply last week, now you're coming in for more. Problem is, patients are more savvy than that, right? So they'll take the prescription to different pharmacies, right? However, California has a very good system where all those opioid scripts go into a central data bank. And so wherever the patient goes, it'll flag if they had a prescription that comes up, right? But most of the opioid epidemic is from people getting legitimate prescriptions and then selling them, right, to people who really aren't in need of their medications. Because there is a need for opioid for pain relief, but they're just misused in a lot of situations. So it's a really good question, and I wish I had more time to discuss it with you, because it seems like it's something you're really interested in because it's such a big issue. And now we have fentanyl, right, which is the big issue. All right, so I think my time is up, so thank you very much. But before I go, yeah, I'll just show you guys, this is Chapman. I know not all you guys are interested in pharmacy, but we do have an accelerated program. It's 2+3, coming out of high school. You do 2 years for your pre-pharmacy and then go into our 3-year PharmD program. Next slide. This is some data about it. We really look for excellent students, which I think you guys are, but we're looking, our typical student has 4.0 weighted GPA, multiple AP courses, and so forth. And that's because you're doing your 2 years of prereqs in 2 years, right? And so there's a bunch of semesters that you have multiple science with lab courses that you have to take. If you want to know more information, you can always contact me, but also we have Discover Chapman events. If you go to Chapman website, you can see that. This is a famous quote of mine, because you guys are starting out, you got a long road ahead of you, which this helped me through my career. And it's not time itself that matters, it's what you do at that time that counts. Time will pass no matter what you do, so you might as well do something great, right? The last thing I'll say, though, because I know I'm over time, when you look at what you're doing, all the studying, all the coming to meetings, please keep in mind that no matter what health profession you plan on going into, you're doing it to benefit patients, right? And I know we know that, but sometimes we forget about it when we're stressed out about classes. And more importantly, when you're learning in your classes, your focus should be on attaining knowledge and maintaining that knowledge. And I'm sad to tell you, even though cramming for exams will get you good grades, it's going to hurt you later on when you need to pull that information in, because you forget about 75% of the information that you cram within a week, right? So if you can get in the habit of really studying regularly and putting that information into your long-term memory, it'll be there by the time you start caring for patients and need to make use of it. So thank you very much. I very appreciate it. Oh, thank you so much.